Organ donation has always had a kind of stigma, probably more in this country because of all the illegal activities that took place around organ donation about a decade or two decades ago. And ever since, it's always been a difficult thing to convince people that it's not wrong to donate your organ. It is changing now. At least patients for cadaveric donations are coming forward when their kith or kin are in the deathbed and brain dead. But live organ donation has still not caught up in this country. Live donor option is something that we really need to push forward. It doesn't have to be that a family has to have the same blood group or matching, because there are enough people around who would probably have the same problem in their families, and if they're open to the idea of giving their organ to the family of somebody else and they get from the other same family an organ, it works works best for both the patients. But 5 lakh patients waiting for transplant in this country, we have to bridge that gap somehow. And I think live organ donation is the only way.
So basically, there's a huge shortage of organs in our country. The number of people who require an organ for a transplant, it could be any kind of a transplant, is far, far more than the number of organs that are generated each year, either through living donation or through deceased donation. And unfortunately, this is an ever-widening gap. One of the main contributing factors, of course, is the lack of awareness, and not just amongst the general public, but also amongst the medical fraternity. We at the Mohan Foundation truly believe that deceased organ donation or donation after death is really the answer to the country's organ shortage problem.
A lot of people would go and buy a kidney, and because buying is illegal, they'll go to any doctor shop here and there that nefariously do things. That could create complications, and that could be worse than not having the transplant in the first place. But if you go to a legitimate place, do it in the right way, with the donor equally willing, matching, all of that's important, then you stand a chance. But the problem in this country is the laws are designed in such a way that it makes it difficult for family members or friends to donate, unless you're blood related, and there's a definition of blood related. If you don't fall within that definition, then you are not allowed to give it, and that's the problem.
There's a question one always has in mind, that how do you manage non-related donors transplant to happen? It always comes to mind that somebody's making money and the government says, we don't want this to happen, so they shut down non-related donors transplant, like it happened in Lanka recently, Sri Lanka. They've closed the doors for non-related donors. So how does one go about this in a legal way, in a very clear and way that nobody really feels that they're being cheated of an organ? I think the government should step in, personally, they should step in, be part of the program, work with the doctors, cut the middleman out, and try to see how the patient can directly deal through the government with a potential donor who's willing to save this patient's life and probably save his own family. It could be some kind of investment of the money from the recipient put away in deposits where the donor gets regular income, so nobody's cheated and it's all overboard. I guess it's a lot of hard work to get a system like this in place. But I'm sure if a lot of foundations in this country who are already working with donors and recipients could help in some way and get the government to look at it, this program could work.
And come to think of it, such a logical thing to do. You've died, you don't need those organs anymore, they're of no use to you. And there are people who actually could get a new lease of life through these same organs that are of really no use to anybody. I mean, as simple as that. So I really think there's a need for each one of us to begin to think about this, think about organ donation, discuss it with our family members, and really come to some sort of an understanding as to what we would like to do with our organs once we are no more. And of course, then we pledge for organ donation.
So there's two battles to fight. One is a social mindset, and the other one is a legal framework for donations. But anyway, all said, I did not have complications other than what is normal. I took a while to recover. My brother, on the other hand, started working within 3 weeks of getting out of the hospital. He went back to work and was doing his surgeries. He's a surgeon himself. It is a complicated procedure, no doubt. It is a long procedure. I think the donor has a lot more happening on his body or her body than the recipient. But yeah, once in a while I feel the pain, but it's no different from a muscle pain here and there, so it's okay. It doesn't come in the way of my activities.
Transplant is not the end-all after treatment for chronic renal disease. You need to take care of the kidney that you now harbor from somebody else. That would mean a lot of work in terms of keeping healthy, in terms of diet, and more important, keeping your medications going for the rest of your life. And that would mean regular exercise, positivity in your mind, good healthy food habits, not eating out, and avoiding places where infection is possible. These sound difficult, but as a doctor, I manage in the hospital. I work a full hospital day, 16 hours a day, around infections, but I still able to logically, smartly take care of myself, and I think general public can do it.
The discussion has to happen in a family. Even if you want to donate an organ post your death, it's important that you tell your family what you wish and what you like about this, why you want your organs donated, because ultimately they have the last say in it. You don't, because you're dead. But even if it's on a will, they are not obligated to go through with it. So they have the last say. So it's important to have this discussion with the family.
So yeah, I think it is very important for people to realize and understand that it is a huge help to somebody who needs it. And if a person does have the courage to go through it, one should definitely help out. If not, I would say, at least, after one's lifetime, one should definitely go with organ donation.
She said something about if you have the courage, you should go and do it. This whole story is about there's no question of if you have the courage. Everybody has the courage. It's the information that makes you feel comfortable doing it. It's no big deal. So it's nothing to do with courage. It's the will to gift a life. And when you want to gift a life, courage will show up.